To transfer your medication into the DoseRite jar, remove the blue cap and press down on the clear bottom until it reaches the base of the jar. Transfer your medication into the empty jar by squeezing your tube. Or transfer the medication from your jar with the wooden spatula provided. When medication transfer is complete, replace the blue cap. Remove the cap from the medication jar adapter. Prime the jar by pushing up on the bottom of the jar until medication appears inside the adapter. Attach a dosing syringe to the adapter until tight. Begin dosing by slowly pulling on the plunger until the medication reaches the prescribed level. If medication fill is incomplete, remove the syringe and reprime the jar. When the dose is complete, remove the syringe and place cap on the adapter. Attach disposable applicator tip to the syringe. Insert applicator into the anus until reaching the safety flange. Press on the plunger to apply the medication. Rotate the syringe slightly while removing to disperse medication. After applying medication, remove the applicator from the syringe and clean with warm soapy water and rinse. Wash syringe with warm water and store for future use. If you have trouble inserting the applicator all the way, or you experience any pain, try a different self-medication position or have someone help you apply the medication. A lubricant such as Aquaphor can be used to help with insertion. Make every day pain-free.